I'm Associate Professor Jodie Ingles and I'm the head of the Clinical Genomics Lab at the Centre for Population Genomics at the Garvan Institute of Medical Research. Probably one of the biggest challenges for our families though is the issue of sudden cardiac death. So that is one where families have actually experienced a young person who's died suddenly, generally a completely healthy, well person who's died out of the blue. That's a really significant traumatic event for families, as I'm sure you can imagine. But secondly, for those who get diagnosed with a condition, knowing that the small risk of sudden cardiac death can be really difficult for someone to live with, and not knowing if or when that will happen as well. I really hope that my research into the future will improve the way that we can give certainty and answers to families when we see them in clinic. For example, knowing who in the family might be most at risk of really severe outcomes like sudden cardiac death, so that we can enable prevention strategies and prevent that. Understanding how we can use genomics to diagnose cardiac disease. There's lots of our patients who don't actually have a clinical diagnosis for their heart condition despite it running in the family. So we can use genomics to understand the underlying cause of that, which might even give hints as to how we could best treat those people by understanding the underlying mechanisms of their disease. Also being able to ensure that when we see families, that the information that we can offer them and the certainty in that can be not just for individuals if they're from a white European background, but for all people in our population, and so that we can equitably make sure our discoveries benefit the entire population.